So I want to welcome you to the webinar this evening for the FDNY EMS, the paramedics and the fire inspectors. So first of all, let me introduce you to the people who are going to be speaking tonight, and I'll give you a little bit of the agenda. I have my partners, Dom Penson, Dana Cohen, Lee London, and we are very fortunate tonight to have Liam Lynch of NICOSH, who I didn't even know you were joining us this evening. So thank you, Liam. And Oren Barzilay is here. He's president of 2507, the uniformed paramedics, EMTs, and fire officers. Somewhere out there is Vincent Barrielli, who's the president of the Uniform EMS Officers Union. So I can't see you, Vincent, but I'm so glad that you've joined us. And also, we're lucky to have Gary Smiley tonight of Local 2507. He's the World Trade Center liaison and a retired rescue paramedic. So thank you guys for joining us. We're going to be starting off with a short 3-minute video that'll give you a rough idea of what we want to talk about this evening. And then we're going to discuss how, what the big issues are that affect the EMTs and paramedics and fire inspectors right now, and what we'd like you to help us spread the word to those who aren't listening tonight, or to the widows and widowers who have lost a loved one, because there's a strict deadline and we don't think many people know about it. I forgot to introduce Marianne Pizzitola. Marianne, thank you so much. Raise your hand so everybody sees you. Marianne is president of the New York City Fire Department EMS Retirees Association, and thank you so much for sharing the information about this evening's webinar.
The first thing that I hear from the non-first responder community in Lower Manhattan is, look, I'm sick, but I don't deserve anything. I'm not a first responder. I just lived here. I just studied here. I just went to school here. I just raised a family here. Your presence here was an act of courage and resilience. The first responders, I'm in awe, but I also am in great awe of those who came back to a war-torn neighborhood that was clearly toxic. We knew it, but you stayed anyway, and you allowed this area to grow and to become the hub. But it's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. It is very important that every community member who lived anywhere south of Houston understands that you are covered. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
I was on my way to work when the first plane hit. I was working for Goldman Sachs. I actually worked for them for a total of 21 years. I always thought that those programs were geared for the firemen and the police officers, but I'm one of the victims of that.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes 17 and 18 years later, such that it is as though never smokers are smoking 2 packs a day.
My law firm represents over 15,000 people in the 9/11 community. And the majority right now are first responders, but every single day we hear from more and more survivors because we're doing this outreach. Basically, to be entitled to compensation, you need to prove that you were below Canal Street or on the Fresh Kills landfill, either caught in the dust cloud on 9/11, or for 24 hours during the month of September 2001, or for 80 hours, which is just 2 full work weeks between 9/11 and May 30th of 2002. And you need to get 2 people to sign an affidavit attesting to the fact that I saw him. I worked next to Joe. I went to school next to Francis. That's all it takes. There's a reason why my firm takes all this so personally. I have 6 young people who work for me who have lost a parent or a spouse as a result of World Trade Center toxins. 9 people in my law firm, including me, are cancer survivors. The information you get from us is going to be compassionate, and it's our pleasure to help you. So since we're mostly speaking to a group of EMTs, paramedics, and fire inspectors, all of you were down below Canal Street or at the Fresh Kills landfill or at the morgues. And those are all eligible areas. All right, so Lee, would you speak to some of the most common illnesses that we're seeing or that the doctors at the health program are seeing?
Sure, and thank you everyone for joining us. And we're really just trying to get the word out to you first responders and volunteers, because it shocks me every day how many EMT, FDNY are not even part of the health program yet and haven't even registered with the Victim Compensation Fund. We don't want people starting this process when they get that oh my God moment. You know, we want people filling out their affidavits now, but we want to make sure people are aware of the most common cancers that we're seeing, because it takes that long to develop. Skin cancer is not one of the major cancers that I'm getting calls about every single day. Basal, squamous, melanoma, skin cancer is all covered, and they don't check for it at the World Trade Center Health Program. They will certify it, but they won't give you a full body skin exam. So I'm here to make sure everybody calls up their local dermatologist and gets a full body skin exam. And with COVID and everything else happening right now, we want to make sure people aren't missing their appointments and they go for regular checkups. But prostate cancer, breast cancer, male breast cancer are all cancers that we're seeing in the 9/11 community. And, you know, people have prostate cancer and breast cancer through, you know, a lot of times people tell me, no, my family had it. No, that is not it. These cancers are much more aggressive in the 9/11 community. And we want to make sure everybody's bringing this to the attention of the World Trade Center Health Program and the Victim Compensation Fund. Thyroid cancer as well, but also a lot of non-cancerous conditions. Many people have interstitial lung disease, sarcoidosis, and respiratory conditions. And these are the conditions that make you immune compromised, because God forbid, when you're out there and anything happens, you want to make sure you protect yourself.
Thank you, Lee. And I want to mention something that you touched on, which is that so many doctors who are not in the health program might see a patient and say, oh, you had a family history of breast cancer, you had a family history of skin cancer or prostate cancer, it must be because of that. The doctor's entitled to his or her opinion. But according to NIOSH and the National Institute of Health, there is a presumption linking these 68 cancers and the non-cancers that you see on this list to your toxic exposure. So you don't need your doctor to write a letter or testify saying, oh, your prostate cancer was probably caused by your toxic exposure. All you need to do is prove that you were there for a certain amount of time and that you developed the cancer after the latency period. And we'll talk about that in a couple of minutes. Great. So there are deadlines, and there are strict deadlines set by Congress. So in general, you must file with the Victim Compensation Fund within 2 years of the date that the injury is diagnosed and then certified by the health program. I suspect that almost everybody in this webinar tonight is already in the health program. And so many of you, because we see this every day, aren't aware that you've already been certified, even if it was just for GERD or asthma or sinusitis, you've been certified. Well, your 2-year window started the date your certification letter was written. The Special Master of the Victim Compensation Fund did a wonderful thing, not just for people who have been certified already and missed the deadline, but for all the widows and widowers out there whose loved one passed away more than 2 years ago. The Special Master has extended the deadline to next July 29th. And please, we ask you, reach out to the widows, widowers that you know. Make sure that they have registered and make sure they know about next July's deadline. And after next July, sadly, the 2-year deadline would be starting again. So let's take advantage of this 7 months window that we have and get as many people into the Victim Compensation Fund as possible. Lee also mentioned something that we're going to be harping on today, which is even if you're healthy, register now. Protect your family, because you don't want to register the day your doctor tells you, gee, I'm sorry, I have bad news for you. You have cancer. Because if, God forbid, in 20 years, you get those words said to you, it's going to be a lot harder to find two witnesses to sign an affidavit saying, I worked with you, I saw you there.
The 9/11 community is particularly susceptible to developing severe illness when it comes to COVID-19. They have conditions and comorbidities that make it likely that if they contract COVID-19, they can, develop, pneumonia and develop, a severe condition that will, it's not good. And this is actually a really good moment in time, even though I know it doesn't, feel like it. But we need to go to our annual exams and get checked out by the World Trade Center Health Program and by our doctors to make sure that we are keeping ourselves as healthy as possible and our conditions are stable, so that, God forbid, if we get COVID-19, it's not a death sentence.
Thank you, Liam. Would you briefly tell us who you work for?
Yes, I work for NICOSH, the New York Committee for Occupational Safety and Health, and we are a nonprofit that's there from the beginning, working with the 9/11 responder and survivor population. And I personally work with the population to enroll them in the World Trade Center Health Program. So really happy to be here and talk about this. Doctors who are in this program specialize in treating 9/11 responders, and they understand the unique circumstances of the conditions, and they have experience in caring for this population. And this specialization should really just be taken advantage of. This program is not static. It's ever evolving, and it's keeping up, and it's trying to keep up with the aging population and the changing circumstances of this population. And part of that is that if you opt in as a member of the World Trade Center Health Program, your patient data can be used for extremely valuable research that helps the program care for responders of disasters and exposures in the future, but also for this population. So, we now are covering 68 cancers and a whole bunch of aerodigestive disorders and mental health conditions as well. But in the future, if there's enough data that shows that exposure is related to other illnesses, then they will add those illnesses to this healthcare program. As we know, your annual medical monitoring exam, you're eligible for. Treatment for your certified 9/11 conditions is completely comprehensive. You have medical tests, doctor visits, surgeries, prescription drugs, and there's also some other benefits, such as benefit counseling. And not to beat a dead horse here, but early detection can save lives. So please go to your annual exam. And this is also for survivors as well. So not just responders, but also people who were, down in that area. So if you know anyone, they are eligible for this program too.
Great. Lee, I'm going to let you speak to this, but first I wanted to mention one thing. Somebody submitted a question that I think is very relevant right now, which is, I'm already in the health program. Does that mean I'm also in the victim compensation fund? Lee, what's the answer?
No. So what I was going to say is that there were so many programs back in 2002, 3, 4 that many people registered for and joined, so they feel like they are covered. But there were so many programs back then that if you're part of the health program, that does not mean you're part of the victim compensation fund. And that is the biggest distinction that I want to make. You must call and confirm, and you must register to protect yourself, because the victim compensation fund, even though they work with the World Trade Center Health Program, is a separate registration process. They have a separate presence process for proving that you were there. So you being certified is amazing, but you still need to protect yourself for the victim compensation fund benefits that you are also entitled to. The victim compensation fund does offer great benefits that I want to explain right now. So not only will they cover out-of-pocket medical expenses that aren't covered by the World Trade Center Health Program. So if you were diagnosed with bladder cancer in 2008, cancer wasn't even covered back then, and you paid out of pocket for all of your medicals, you can get that reimbursed directly back from the victim compensation fund because the health program wasn't covering, you weren't even part of the health program. The health program will not retroactively pay you back for your medical expenses, but they will cover future costs if it's a World Trade Center physical condition. So the benefits of the Victim Compensation Fund with out-of-pocket medical expenses alone is worth joining. But the monetary awards for non-economic loss claims for pain and suffering can range. But the best part about the Victim Compensation Fund is that if you receive an award for asthma today, anywhere between $20,000 and $90,000 based on severity, if you get diagnosed with prostate cancer 10 years from now, you can amend your claim for an increased award. One of the biggest reasons why Michael went to Congress last year, why the firm did to get the Victim Compensation Fund extended to outlive us all, was because cancers are developing now. You know, the cancers will develop 5 years from now that are 9/11 related. So we want to make sure the Victim Compensation Fund was open to anticipate this so people can get the benefits they're entitled to. So as you can see from the screen, non-life-threatening illnesses such as asthma, sleep apnea can range from $20,000 to $90,000 based on severity. But then you have skin cancers that can range from $90,000 to $250,000 and so on. And the biggest reason why I'm saying this to you is not only for a pain and suffering award, but also for an economic loss award. If you were working full-time and your respiratory or cancer condition forced you out of employment, the Victim Compensation Fund will make you whole again. We can make a loss of earnings claim for you, which is a substantial award to protect you, protect your family, because but for your cancer, but for your 9/11 exposure, you would have kept working. So that's a huge benefit that I want to make sure people understand. And it gets complicated with disability pensions and being on Social Security disability. So please ask questions about this, because not only can you make out-of-pocket medical expenses, you can also make wrongful death claims, which Dom and Dana will speak about next.
With respect to the deceased claim awards, the VCF compensates the same things for a deceased claim that Lee was talking about. They provide non-economic loss awards for somebody's pain and suffering for having cancer, for example, or they also provide non-economic loss awards to dependents, spouses, and children who lived with the deceased before the decedent passed. They provide lost earnings awards. They provide awards for what's called replacement services to compensate the surviving family for the loss of the services around the house, out in the yard, the things that we all do for one another when we live together. Those things have an economic value. The VCF recognizes it, and it provides awards to compensate for the loss of those services. They also provide compensation for burial expenses. So if there are any kind of funeral expenses, the VCF will cover. These awards can be quite substantial. Obviously, if somebody has more than one cancer, they're going to be entitled to a higher award, and there are such people. And of course, depending upon the age that somebody passes away, if they have more years of earnings before them when they pass away, that is going to result in a greater award. But these awards can be hundreds of thousands of dollars. They can be millions of dollars. And which is why it's so important that we all do what we can in the 9/11 community to protect our families and protect their rights. And Dana's going to talk about how we can do that today.
The most important thing is talk to your family. Make sure that they understand that they will be entitled to benefits if you were to pass away from one of these 9/11 illnesses. The reason families don't come to us in time is that they don't know that they're eligible. They don't know that there's a presumption. They don't know that this program is there for them. Sometimes they think their loved one already recovered, and so they can't. That's not true. Someone who recovered in life, that does not mean that their family can't make a claim. That family can make a claim. So talk to your family and make sure they understand that the VCF is for them.
In many of these cases, it's not the widow's fault, and I'll tell you why. If we had a case just last week, an EMT widow living in Florida, they moved down to Florida back in 2006 when her husband retired. He ended up getting prostate cancer in 2007. He died in 2009, well before cancer had been linked. All she remembers is Christine Todd Whitman saying, "The air is safe." So why would someone like that ever be aware of the fact that there had been a presumption linking her husband's cancer and death to the World Trade Center toxic exposure. She wouldn't be.
You will have to provide 2 affidavits to the Victim Compensation Fund in order to establish that you were in the exposure zone during the exposure period. That's done with witnesses. You need 2 of them. Like Dom said, it is a very good idea, even if you're not filing, to have right now, to have a lawyer look at those affidavits, because we know what they should look like. They shouldn't be family members. We know what information they should contain, and we will help you to make sure that those affidavits are in order. For many of our families, that wasn't done. And so they now have to go and try to find those witnesses. And in many cases, it's difficult. We help them, and we do everything we can to track down the witnesses we need, but it's harder, and it adds to the time it takes to file the claim. Even if you have a very minor illness, if you have sinusitis and you could live with it, make a claim. File with the Victim Compensation Fund, because your eligibility will be established. And that means that's something your family won't have to do should the time come. And the last thing is that we recommend that everybody get a will. In our law firm, we do this for our clients for free. We think it's so important that every single one of our clients who wants a will gets a will if they live in New York. What should you do? Of course, register for the World Trade Center Health Program. That is your program. You should be in it. Register with the Victim Compensation Fund. The Victim Compensation Fund is different than the World Trade Center Health Program, and you have to register for them separately. You enroll in the health program will certify your illnesses, and you register with the Victim Compensation Fund, which will award compensation for conditions that the World Trade Center Health Program has certified. Get your proof of presence in place. Get those affidavits. We can send you blank affidavits, and we can review them for you to make sure that they're sufficient. Don't let COVID keep you from seeing your doctor. Go to the dermatologist, get your mammogram, go for your annual screenings, go for your PSA test. Take care of these things. Early detection is the best thing that we can do for ourselves. We take care of our families, but we also take care of ourselves. Get a will, get a healthcare proxy, and spread the word.
We not only do free wills for our clients, we also do them for anybody who's a member of the FDNY, whether they're a firefighter, fire officer, EMT, paramedic, fire inspector, officer. We will do your will. So Hillary, would you please let us know if there's some questions that have been submitted?
Yes, there have been. The first one is, any idea if they're going to cover autoimmune diseases and fibromyalgia?
Okay, so Gary, you spoke a little bit about this. You didn't mention fibromyalgia. Would you please discuss that for a minute?
It's important that even though it's not covered, that we get you in the registry, because we have to build a case going forward for getting this covered. Many, many members suffer from it. I mean, to the point where I've seen people that can't even stand without bouncing up and down on their feet because they're in so much pain. So it's important that you report your symptoms when you go to your annual medicals. If you have any symptoms in between your annuals, you tell your doctors so that they can document it. And that's so eventually, when this is covered, we can get you taken care of.
Is anything being done for people that fell into the latency period for their cancer? We were told my cancer surfaced too early.
This is partly what I was alluding to before, that for blood cancers, just to put it as simply as I can, for blood cancers, there's a 2-year latency period. For solid cancers, there's a 4-year. So if the diagnosis comes for a solid cancer after September 2005, then the cancer is deemed eligible. For a blood cancer, if the diagnosis, for some, I think it's at least 6 months.
Actually, for some, it is 6 months. Yeah,
exactly. 140.
If we can show that the particular cancer in question is a rare form of cancer, then the VCF will consider waiving the latency requirement and and giving an award.
Okay, and the one latency period you didn't, that's a little bit different, is thyroid cancer. That is deemed eligible if it was diagnosed more than 2.5 years after 9/11. Everything else, though, is after September 11th, 2005. Hillary?
How can I reclassify my pension as a WTC disability pension?
So with NICERS, it is difficult, but there's a lot of legwork that needs to be done. But once you get that certified, with the attorneys, we'll assist you to getting that reclassified.
Gary, is there anything you want to say about NICERS and any advice you want to give those who are listening now?
Those that have World Trade Center conditions that are already retired, I don't know how many are on this call, but I mean, yes, if you're significantly ill, it doesn't cost anything to file for a reclassification, and I will walk you through it. I mean, thankfully, Jeff Goldberg and his firm, Jeff will walk me through cases so that, I mean, I just did an appeal yesterday for one of our cancer girls. We've had some success, and it keeps the costs down because Jeff's an amazing guy and he doesn't charge for that. But I mean, I can walk you through that. I mean, it's just doing the application. You're entitled to that. I mean, everyone knows how I feel about NICERS and how they treat our members. I mean, it's a constant battle. Unfortunately, because of COVID, everything has been shut down. We have legislation pending in Albany for several bills that are stuck there because of COVID. A lot of other issues regarding NICERS are stuck because of COVID. I mean, it doesn't mean that I'm not fighting this every day just because there's a pandemic. I dedicate most of my day to this. I mean, I don't discourage anyone from reclassifying. It is not going to hurt your pension in any way. The only positive that I can tell you that we've received is that if you're an active member and you're sick and you have enough time for a service retirement, we urge you to retire. Put in your paperwork and retire. NICERS has assured us, and Oren and I specifically, that they will entertain, if you file for a regular retirement, they will entertain a reclassification for World Trade Center after you're retired. If you have a regular retirement from an orthopedic injury, a regular 3/4, that's not the case, only in World Trade Center cases. So there are avenues for us to go down, and it's important. Paid into the pension system, you're deserving of it. In 2005, Governor Pataki signed the presumption bill. NICERS refuses to acknowledge that, and that's why we fight. So you don't give up, you fight and fight and fight.
Gary has been a great resource to us as well. He's been doing most of the work that's related to World Trade Center victims. We do refer them all questions and issues to him. So I want to personally thank Gary for being part of this team and helping us with all the issues our members are challenged with.
I agree with that, Gary. I mean, for all the money that the EMTs are paying you, it's amazing, but you are a treasure to this union, and we thank you enough. I mean, and those of you who want to get a hold of Gary, all they have to do is
call me. Call the union office, they'll give you my number, or call me, 917-692-2124. I never take my cell phone off. I mean,
Gary, could you repeat that just a little slower?
Sure. My cell phone is 917-692-2124. Call me or text me. I mean, I'll never not.
All of you, he means it when he says he's available. He is there for you.
If you are suffering from a severe cancer, you do not want, and this is what I say to all of my clients, you don't want, God forbid, your widow to deal with reclassification. God forbid you pass away from a 9/11 condition. You want to make sure that you get these benefits now, because you can make an economic loss of earnings claim to the Victim Compensation Fund based on that reclassified pension. And that is a huge benefit that the Victim Compensation Fund offers. And as Gary can attest to, if you're not happy, or if you're not happy with your award and so forth, we will appeal it. We will appeal it and fight for you, because that is one of the benefits of the Victim Compensation Fund with what they allow. They allow to appeal claims, and also it's a different process for everyone, as Gary can explain. But anybody suffering from a horrible respiratory condition or cancer condition that can't work anymore due to their condition, I encourage everyone to reclassify now, get the benefits now, so you can use it for the Victim Compensation Fund.
And Lee, can you also speak for a moment? And I hate to talk about this, but we're talking about aggressive cancers in many cases. Can you talk about a wonderful thing that the Victim Compensation Fund does for people who are deemed terminal by their doctors?
So the Victim Compensation Fund has an amazing process where you can avoid the World Trade Center Health Program certification process altogether and get an expedited award and find your claim eligible through the VCF if you are terminal with a stage 4 diagnosis. So many times our clients will call us and say, oh my, I just got that call. My cancer's turned for the worse. You know, I can't get an appointment at the health program. And we can turn around and get them in a Victim Compensation Fund award in less than 3 weeks, 2 weeks we just did for somebody, so they can make sure their family is protected, they're financially, you know, they bring that in now rather than having their wife deal with it. Now, they're still entitled to full wrongful death benefits, but this terminal expedite process, while you are fighting for your life, gives you that peace of mind that your family will be protected. God forbid anything happens. The Victim Compensation Fund has a terminal expedite process and a financial expedite process, which you must look into. God forbid any of that impacts you at all. But it is a huge benefit to the 9/11 community.
I can't find the people I worked with at Ground Zero. Can the Retirees Association help me find them so they can complete an affidavit?
So the answer is yes. We have a large database of retirees that we can reach out to. If you remember who you worked with or what station you worked with, we can reach out to those people or even their officers and help you get those affidavits completed.
I don't feel safe going for WTC annuals due to COVID. Can I defer it?
So telehealth services are available, and you guys should definitely take advantage of it.
So in the national program, especially for our retirees that are around the country, that's really important. They should have received a telehealth card. They can schedule that appointment, even if they're not comfortable, because a lot of the national programs send them to a very public clinic or to hospital settings. If they're not comfortable to going there for their full annual, at least that they can have appointments via telehealth or with their physician, and reduce their exposure, but at least stay in contact, especially if there's something that's coming up where they're having a symptom that they have a question about or a concern about, or that they need to have a test, but they're concerned. They can have that conversation with the physician via telehealth, and then they can mitigate their concerns and help them address their situation. So even if you're in the national program, that's not something we should be avoiding. We need to address those as soon as we can. They do have us go to those appointments every 12 to 18 months, and we need to try to stay on that schedule.
Marianne, that's a question that we get asked a lot, are guys and gals. They're up here in New York during the summer, and then they go down to Florida or North Carolina after they're retired for the winter.
If you're in the national program, you are able to go to any clinic that you want. What they don't want to see is that you're going between FDNY or national program. They want you to pick a program.
Can you speak to the death benefits for EMTs?
If it's classified as a line of duty death resulting from World Trade Center, they have to file a claim, and we either direct them to Gary or your firm as well, again, to assist them with this information.
You have to update your beneficiaries. When you retire,
yes,
you're given a final option through NYSERDS. Once you file that option, that's it. You're done. You cannot change it.
But I have a question, one final question, if it's possible to ask.
Sure, go ahead.
How does a 911 survivor who has COVID and gotten sicker update their claim, or can they file another claim?
Okay, that's a great question. First of all, I want to say the Victim Compensation Fund Special Master just recently announced that anybody who has an underlying respiratory illness or an underlying cancer condition where their immune system is shot, if they die of COVID, the Victim Compensation Fund will view that as a 9/11 World Trade Center death. We were worried about that, Oren, because there is a lot of science that says that if you have a compromised immune system or a pre-existing respiratory illness, you are so at risk to COVID. So the Victim Compensation Fund recognizes that, and they will recognize this and give full death benefits to anyone who dies of COVID. And as I mentioned earlier, we've already lost over 100 of our clients, all responders, or mostly responders, I should say, who had these underlying cancers or respiratory illnesses and who sadly passed away. So if we're going to end on a positive note, that's it. At least we won't have to fight that with the Victim Compensation Fund. Gary, Oren, Marianne, Vinny, I know you're out there as well. I want to thank you so much for inviting your members, your retirees to join us today. I hope all of you thought that this was helpful. I hope you will share the link to this. We're going to send everybody a link to tonight's webinar so you can share it with your friends. Reach out to your friends. Reach out to your former coworkers. You know what? What a great opportunity if you're retired. Hey, I just heard this webinar. I want to let you know. I want to make sure you're protecting your family, or that, did you know you're entitled to benefits too because of your husband's death back 12 years ago? Don't let anyone miss the deadline of next July, and keep your appointments. Good night, everybody. You're welcome to call us anytime. We are here for you all the time.